For our physical health, our society relies on available medical knowledge. Although many diseases and conditions have been around for years, existing medical information is not always accessible and therefore not used for new patients. Far too little are existing databases and know-how used in treating patients. Doctors rely on their years of knowledge, and a few are able to educate themselves broadly enough around new studies and subsequent guidelines. As a result, there is little or no control over medication used in polymedicated patients. They are administered cocktails of sometimes more than 5 forms of medication, leading to unnecessary complications, illnesses, doctor visits, and hospitalizations. We know from research that currently out of 16,000 patients, 2 people have a lethal medication regimen, and 1,100 have a questionable regimen, which increases the likelihood of admission, an additional doctor's visit, or premature deterioration. If we extrapolate this to the world population, it is extremely concerning. The patient is unaware of this, but obviously suffers physically. The pharmacist is often consulted directly by the patient, who often does not consult a general practitioner. As a result, the pharmacist bears a great responsibility, but loses up to 3 hours of time for each patient when he has to make a medical report, as is mandatory in many countries. In doing so, he has to consult several specialized databases and programs which do not share information among themselves. The doctor lacks important information to know the administered medication cocktail. Combined effects of medication are rarely studied, and over-the-counter medications are invisible to him. Finally, the government is seeing costs soar due to the high number of hospitalizations, so it needs to intervene as well. In addition, governments must take into account the growing elderly population. Our life expectancy is increasing thanks to advances in science and technology. With the comprehensive medication review tool, rapid medical information sharing is the reality, and the knowledge of the globe is at the user's fingertip. Through the Medical Society of Finland Duodecim, guidelines are shared with the doctor for best practice at the point of care. The system is supported in several EU countries. It is a medical device and is thus a European certified product for medical use. The comprehensive medication review tool contains information collected over many years on diseases, combinations of medications, and their possible side effects. Based on this information, the healthcare professional can make an informed decision in the search for the most appropriate medication for a patient. Doctors and pharmacists now immediately know each patient's blood values, kidney values, and full medication plan. The information in this database is international, but it is possible to add a local database with guidelines and/or medication list per country or region. In addition, it is possible to link wearables and diagnostics to the system so that the symptoms can be dealt with preventatively. Gaining access to the comprehensive medication review tool is easy and can be done through a simple API integration. In no time, you will have access to all available medical information collected in the database over the past 10 years. Do you want to be part of this medical knowledge innovation? Contact us for a demo.